Hey everyone, and welcome back to the channel. Today we're going to talk about something incredibly important, something that touches so many of our lives and the lives of our loved ones: long-term care and what it means for our golden years. We often think, I've paid into Medicare my whole life, so I'm covered, right? But what if I told you there's a huge piece of the puzzle that Medicare does not cover, and it's a piece that can change everything? I want you to picture someone you love, maybe your mom, your dad, or a grandparent. You see them starting to need a little more help around the house. Maybe it's just trouble with groceries at first, or remembering to take their medication. Then it becomes a bit more. They need help getting dressed or preparing meals. This isn't medical care in the traditional sense. It is what we call custodial care, the daily assistance that allows someone to live with dignity. And this is the big surprise for millions of American families. Medicare, for the most part, does not pay for this type of long-term custodial care. Let that sink in for a moment. The very support system that helps our seniors with the basics of daily living, bathing, eating, moving around, isn't covered by the primary health insurance they've relied on. Medicare is designed for short-term skilled nursing care after a hospital stay, like physical therapy to recover from a fall or surgery. It was never intended to cover ongoing personal care, whether that's at home with a home health aide, in an assisted living facility, or in a nursing home for an extended period. Now you might be thinking, this sounds scary, and honestly, it can be. The costs are staggering. According to recent data, a private room in a nursing home can cost over $100,000 a year. Assisted living can run $50,000 to $60,000 annually. And even having a home health aide come for just a few hours a day can add up to tens of thousands of dollars. For most families, paying this out of pocket is simply not sustainable. It can wipe out a lifetime of savings in just a few years. We spoke with Sarah, whose mother recently needed to move into an assisted living community. Let's listen to her story. My mom, Helen, was always so independent. She lived in the same house for 50 years. But after a couple of falls, we knew she couldn't be alone anymore. We were in shock when we found out Medicare wouldn't help with the cost of her new place. We thought we had planned for everything, but we never planned for this. It was a huge financial and emotional blow to our entire family. Sarah's story is not unique. It's happening in communities all across the country. The emotional toll is just as heavy as the financial one. Families are faced with heart-wrenching decisions. Do they drain their own retirement funds? Does an adult child quit their job to become a full-time caregiver? These are choices no one should have to make under pressure. So, if Medicare isn't the answer for long-term care, what is? This is where planning becomes your most powerful tool. The good news is, you have options, but the key is to explore them long before you need them. One of the primary solutions is long-term care insurance. This is a specific type of policy you buy, much like car or home insurance, that is designed to cover the costs of custodial care. The premiums you pay depend on your age and health when you apply, which is why financial experts always stress the importance of looking into this in your 50s or even earlier. The younger and healthier you are, the more affordable it will be. These policies can be flexible, covering care in your own home, an assisted living facility, or a nursing home. Another option to consider is a hybrid policy. These combine life insurance with a long-term care rider. This can be appealing because if you never end up needing long-term care, your beneficiaries still receive a death benefit. It feels like a win-win for many people, ensuring their money serves a purpose one way or another. There's also Medicaid, which is different from Medicare. Medicaid is a joint federal and state program that does cover long-term care, but it's designed for people with very low income and limited assets. To qualify, you generally have to spend down most of your life savings. While it's a crucial safety net for many, it's often the last resort, not the first choice for those who hope to leave a legacy or have more choices in their care. Finally, for some, using assets like a home equity line of credit or a reverse mortgage can be a strategy, but these come with their own set of complex rules and potential pitfalls. It's vital to understand them fully. The most important takeaway from all of this is the power of conversation and preparation. It starts with talking to your family. I know these aren't easy conversations to have. Talking about aging and needing help can feel vulnerable both for parents and for their adult children. But having that conversation now, on your own terms, is so much better than having it in a hospital room during a crisis. Ask your parents, have you thought about what you'd want if you needed help every day? What are your wishes? And if you're approaching this age yourself, start thinking about your own future. What does a dignified, secure future look like to you? Once you've started the conversation, the next step is to seek professional guidance. This is not something you should navigate alone. A qualified financial advisor who specializes in long-term care planning can be your greatest ally. They can walk you through the pros and cons of each option, long-term care insurance, hybrid policies, and other financial strategies, and help you create a plan that fits your specific situation and goals. They can help you understand the fine print and make an informed choice. Remember Sarah's story. The stress her family went through could have been significantly reduced with a plan in place. Planning isn't about being pessimistic. It's about being realistic and loving. It's about protecting your family, preserving your hard-earned assets, and ensuring you or your loved ones have choices and control when it matters most. It's the ultimate gift you can give to yourself and your family, the gift of peace of mind. Don't wait for a crisis to force your hand. The best time to make a plan for long-term care was yesterday. The second best time is today. Start the conversation, do the research, and reach out to a professional. You'll be so grateful you did. Thank you so much for spending this time with me today on such a vital topic. I hope this has been helpful and empowering. If it has, please consider liking this video and subscribing to our channel for more content that helps you navigate life's biggest questions. And please share this with anyone you think needs to hear it. Let's help each other be prepared. Take care.